Hi, my name is Nicholas Jervis, a solicitor and now Director of First Claims. Today we're going to look at medical negligence. What is medical negligence? When has it happened to you? And if it's happened, what can you do about it? Now, generally, I'm pleased to say that despite what you read in the press, despite a lot of negative stories, the majority of the health service is in a fantastic state. We're in a lucky country in the UK, we can go in, we can have treatment, and most of the time people will have the treatment, will have no problems, come out without any difficulties. However, occasionally things do go wrong, and it's normally the horror stories you hear where the wrong limb's been amputated or someone suffered a serious injury as a result of medical negligence. If that's happened, then you may well be able to claim compensation. Now, medical negligence is not an easy claim to prove. You have to prove that the surgeon that treated you has failed above and beyond, has treated you in such a way that no other surgeon would have done, no other general practitioner would have done. They've performed so badly that clearly they have been negligent. Most of the occasions that doesn't happen, but if it does, to prove a medical negligence claim, you also then have to establish that it was because of their failure to treat you properly, or because they didn't do what they should have done, that has led to your injuries and your ongoing pain and suffering. So a medical negligence claim can be difficult to prove. That being said, thankfully now there are so many claims companies out there that will talk to you, explain your situation, and 9 times out of 10, the majority of people thinking about making a medical negligence claim are just happy to have an apology or an investigation by the hospital, despite the press telling you that there's a massive claims culture out there, which isn't proven by any statistics. It's something that they like to say is happening, but generally it's not. The number of claims year on year stays about the same. It's just that the press pick up on 1 or 2 big cases and indicate that there's this big compensation culture. The reason it's important for you to investigate a medical negligence claim if you think you have been the victim of one is that without your circumstances being reported or investigated, if there has been negligence and you've suffered, there's nothing to stop it happening again and again and again. The compensation system in this country means that if you put forward a claim, even if you don't take it, but you put in a complaint to the hospital, they will have to investigate that, and they will see trends that are happening in that hospital. They can put in place systems to stop it happening again. There is a fantastic complaints procedure to follow. It doesn't cost any money. You can follow through a complaint. There is no need to make a claim for compensation following that, but you are completely within your rights to do so if you choose to do so. Medical negligence claims are happening, but they are few and far between. It is not as common as you might expect. If you've suffered an injury and you need help, make sure that you obtain free initial independent legal advice that explains what your options are, if you have to pay any costs, exactly what those costs are, and then you can make an informed decision about whether you wish to take the matter further. It is then your choice to do that if you want to. Thank you.